Hi, my name is Taban. I'm an oculoplastic surgeon with expertise in eye plastic surgery. One of the most common complaints that I get from patients is the eyes look different. The eyes are uneven, asymmetric, the eyelids are uneven, and this has become more prominent in the selfie era when patients take their own photos and they notice the asymmetry. Sometimes these asymmetries are more prominent when the patient is smiling or when they're tired or drunk or what have you. So today I'll be talking about the different causes and management of eye asymmetry. The problem could be because the patient was born with the asymmetry, so it was inherited, or it could be an aging phenomenon, or it could be from trauma or surgery they've had. The problem could be either with the eyelids being uneven, the upper lids, the lower lids, or it could be with the surrounding structures of the eyes, or it could be a problem with the eye socket itself. So the eye sockets could be different. The best way to illustrate this is to go over examples. So here I have some slides that I'm going to go over with. Probably the most common cause of eye asymmetry is the upper eyelid being droopy on one side more than the upper. We call that eyelid ptosis. You can see these two examples. This patient has right upper lid ptosis, making the two eyes look different. The right eye looks smaller. What we did for her is right upper lid ptosis surgery, lifted up the right upper eyelid. So now the two eyes are more symmetric. Similar patient, right side being more droopy, similar problem, similar treatment. Droopy eyelid is very common. In fact, very famous people have droopy upper lids with the asymmetric eyes. This is Kobe Bryant with the left upper lid being droopy, making the eyes look asymmetric. This is Paris Hilton with the left upper lid being droopy, making the eyes look different, the left eye being smaller. Droopy upper lid can be more prominent when the patient smiles. So this is a young patient with the left upper eyelid being droopy, making the left eye look smaller, but that problem becomes magnified when she's smiling, as you can see in this photo. This is another young patient with the right upper droopy eyelid, and this is her after correction. Now let's go to a different category, the opposite problem. If the right upper eyelid is too high, it's pulled, it's elevated, and there are different causes for this. One of the causes could be thyroid eye disease, or it could be prior surgeries, or could be just inherited. This is a patient with thyroid eye disease with the left upper eyelid being retracted. And also the right upper lid is a little bit droopy. So what she had done is the left upper lid was lowered and the right upper lid was raised, making the two eyes more symmetric. The eyelid retraction could be subtle. This is a younger patient, male patient, who complained of eye size asymmetry, and he liked the left side more than the right side. What we noticed is the right upper lid is higher than the left side. So what I was able to do for him was lower the right upper eyelid. So this is him before after surgery. You can see the eyes are more even in the bottom photo. Same thing can happen with the lower eyelids. The lower eyelids can be retracted. Now, again, that could be from thyroid eye disease, it could be from genetics, it could be from trauma or surgery. This patient is a young 17-year-old patient with the right lower eyelid being retracted, pulled away. You can see more white underneath the pupil than the left side. This patient, the other side is involved, left lower lid is retracted. In his case, this was from prior surgeries and trauma. Another common cause for eye asymmetry is surrounding structures. These are two patients, they don't look the same. What we notice for her is she has more fullness here and more hollowness on this side. So solution for her would be taking some skin off here, adding some volume here to make them more symmetric. This is a patient with prior surgery with the two eyes now looking different. What we can note here is the lower eyelid contour is different here than here. Also, the outer corner, the canthus, is pulled down. So this is making your eyes look asymmetric. Let's cover the next category of problems. and that has to do with the eyeball position. First, I'll talk about sunken eye. This is a patient with right eye sunken in and also a little bit down, and this is from a prior trauma, but there could be other causes. Again, it could be inherited or other causes. So you can see from this angle, the right eyeball sits back more than the left side. So what I was able to do for him was put an implant in the right orbit, in the right eye socket, to push the right eyeball forward, and this is him after surgery, so the eyes are more even, in more proper position. The opposite problem is when the eye is bulgy. It could be very mild to very severe, and again, that's a whole other talk of what causes bulgy eyes. Just briefly, it could be thyroid eye disease, it could be inherited, so genetics, those are probably the most common causes. These are two patients with genetic causes for eye being bulgy. You can see this eye looks bigger than this. Now it's hard to see in a two-dimensional photo, but this eye is bigger because it's more bulgy. This is another patient with the right eye being more bulgy than the left eye. So again, the causes could be thyroid eye disease, could be inherited. The eyeball could sit more forward, causing it to look bigger, or the eyeball itself can look bigger as well. And that could be, again, that's genetics. These are two other patients, young patients, who complain about eye asymmetry. We know that the right eyeball here is more bulgy and sits higher than the left side. Very similar case here. The right eyeball is sitting higher and more bulgy than the left side. There could be a combination of problems. This patient has the left upper eyelid being a little bit droopy and the right eye being more bulgy. Or you could say the left eye is a little bit sunken. So things could be relative as well. This patient has the left eye being more sunken and also the left upper eyelid being more droopy. So hopefully these examples show you that there are many different causes of eye asymmetry or uneven eyes. It could be related to the eyelids, it could be surrounding structures, it could be related to the eye socket. So a proper evaluation by a specialist is important to understand the reason for the eye asymmetry, then the proper treatment could be planned. In general, most of these things are surgical procedures, but a lot of them can be done under local anesthesia. There are also some non-surgical options such as filler injections or Botox to make things more even. So that covers our talk on causes and management of eye asymmetry. Thank you.